Let's chat about pap smear guidelines while we try on the new Figs color. This is such a cute color. The recommendation is to get your very first pap smear at the age of 21, not sooner. Back in the day, they used to recommend that you have your first pap smear once you started having sex. That is no longer the recommendation. Your first pap smear should be at the age of 21. So why did they change this recommendation? Pap smears are looking for abnormal cells on the cervix that could then turn into a cancer. And the number one way these cells become abnormal is due to HPV, or human papillomavirus. And we know that HPV is a sexually transmitted infection. So back in the day, they said, well, once you start having sex, you're at increased for getting HPV, so let's just start screening everyone once they start having sex. But now we know that women under the age of 21, even if they're having sex, they are able to clear up an infection with HPV without having to do anything. Most people's immune system, when they're young and healthy, can fight off that infection without needing any sort of intervention. As we get older, it becomes harder to fight off HPV on our own, which is why then we start screening, and if we see that you're HPV positive, we want to take steps to avoid those abnormal cells from turning into a cancer. Absolutely loving this color. Definitely check it out. But get your pap smear at age 21 and watch the 5 tips from my previous video so you know how to keep your cervix healthy. Bye.